Hello, my name is Macy Cunningham. This is my cardiovascular pathology teaching video. My disease is restrictive cardiomyopathy. Restrictive cardiomyopathy refers to a set of changes in the heart's muscle. The heart's ventricles become rigid because of abnormal tissue, like scar tissue that replaces the heart's muscles. As a result, the ventricles can't pump normally and can't relax normally. The atrias enlarge, blood flow is reduced. This can lead to problems like heart failure and arrhythmias. It is most commonly found in the left ventricle, however, it can be in the right ventricle as well. Symptoms include shortness of breath when laying down or with exertion, fatigue, swelling, fainting, lightheadedness, abnormal heart rhythms, coughing. This disease is very rare, and its prevalence really depends upon gender, ethnicity, regionality, and age. The prognosis, people with restrictive cardiomyopathy typically may be possible candidates for heart transplant. The prognosis depends upon the underlying cause. I found that there were quite a few underlying causes. However, regardless of the underlying cause, the prognosis is typically poor. The survival rate for maybe more than 5 years or 10 years, or maybe less. It just depends upon the underlying cause. Possible treatments for restrictive cardiomyopathy. There is no specific treatment for the disease itself. However, they may treat the symptoms, or they may treat the underlying cause. They might give you water pills to reduce swelling. They might give you calcium channel blockers or beta blockers to help reduce the heart's workload and increase efficiency. They might give you ACE inhibitors to help the heart pump better, blood thinners to prevent blood clots, medicine to prevent abnormal heart rhythms, and heart transplants is also a treatment as well. So physiology of the functioning heart. So I drew a couple pictures here. So this heart is a normal heart, and this heart is a heart that has restrictive cardiomyopathy. So this is kind of where we're going to be looking right here at this little wall. So in a normal heart, it's got the little ridges. This kind of tells me that it's flexible, it can expand, it can contract, it can pump well. And this heart over here in the same area, that wall is straight. It's rigid, it's stiff, it's not able to pump or contract as well as the normal heart. So this is kind of a good visual to see kind of where restrictive cardiomyopathy really affects the heart. So the physiology of a functioning heart, it has 4 chambers, 2 atria, 2 ventricles. Deoxygenated blood returns to the right side of the heart. It is pumped into the right ventricle and to the lungs, where carbon dioxide is released and oxygen is absorbed. Between beats, the muscles relax and the heart gets to have a very, very brief moment of just relax. Restrictive cardiomyopathy makes that difficult for a normal functioning heart to do, because the chambers of the heart become stiffer. This makes it difficult for the heart to relax between beats, and makes it difficult for the heart to fill with blood.